had a couple that was here, and it was a fantastic experience for both us and for them. The husband came first. He had a debilitating injury that resulted in him coming here for rehabilitation after his hospital stay. And while he was recovering, his wife, who was at home, became ill and had to be hospitalized. So after her hospital stay, she came here as well. The husband was still here, and they were in adjoining rooms, and it was so motivating to watch them. She would have her walker and be walking down the hall, and he'd have his cane and be walking along beside her with his arm around her. They'd eat dinner together. They'd been married over 40 years, and they were still kissing and loving each other and enjoying their rehab experience together. And they'd be in the therapy gym together. And I think being together was an integral part of their successful outcome here.
Yeah, so I'm very proud of this hospital. Very, proud of the things the nurses and the therapists and our physician, Dr. Venn, with his guidance and his care, we're able to accomplish these things. Dr. Venn came to us from the Rehab Institute of Chicago, which is the #1 rehab hospital in the United States. And for those of us that are in the rehab business, that's a place that you really have a lot of respect for.
We're living longer now, and most of the older people are much more active than they used to be before. So we have to change our frame of thinking, our paradigm on how we need to address the health of these people. So what I have created is we function in tandem, a team of a rehab doctor and a geriatrician. And so I have a co-medical director who is board certified in internal medicine as well as geriatrics. And so whenever a person comes in here, we work in team. She would focus on the medical aspect of the patient, and I will focus on the neurologic, the ortho, and the rehab aspect. And so that ensures that every conceivable medical issues can be addressed. I really love this building primarily because it was designed so that it doesn't look like a hospital. After you go in to recuperate, the last thing you need is an institutionalized look of the facility you're at. It's very clean, very bright. Everyone has a single room, so you don't share with anyone, and it's good. It's actually a win-win situation for everyone. From our perspective, it cuts down on the cross-contamination and infection rate because it's just only one person. From a family and patient perspective, the room's actually designed to be kind of big so that the family can be in there and visit the patient. And psychologically, I think it's really good to have access to family during your rehab.
Our hospital has 40 all private beds, and the latest state-of-the-art technology. We have all electronic medical records, which we are a pilot for the HealthSouth Corporation, and the first acute inpatient hospital in the industry to have electronic medical records. So we're very excited about the potential that provides us for reduced error, better patient management. The therapy gym has all the traditional equipment with stair climbing devices, treadmills, bicycles, recumbent bikes, the ergonometers for the upper body training. And there's also an auto ambulator, which is unique to HealthSouth. It's a special high-tech treadmill device that patients are strapped into, and it supports their weight entirely while their legs are attached to robotic braces that put them through the motions of walking. It retrains the brain as well as helps them strengthen their lower extremities and prepares them to ambulate.
Patients that come here, not only do they have good gains in what they're able to do when they go home, but they like us and they're satisfied with the services they get here, that they receive here at this hospital. And 100% of them say that they would recommend us to a friend or family member to come to this hospital. And I'm just telling you, from someone that's been in the industry for a long time, that is very unusual.